Columbus Small Animal Hospital, loving our work. I'm Dr. Jim Kramer. This is Ivy. She's a beautiful gray female pit bull, 7 months old, weighs about 40 pounds, and she's been hit by a car and has a fractured elbow. The distal humerus is shaped like a Y and is fractured on both sides of the Y, medial and lateral, completely displaced here. This is very serious. The elbow is an unforgiving joint. It's difficult to deal with. The surgical approaches are very complex and difficult. The ulnar nerve and the radial nerve spiral around in this location, which make it really tough to make the approaches safely. Were either of these major nerves to be damaged in this process, then Ivy would never use this leg again, which would be disastrous. Since Ivy is young and still growing, we have to be careful not to disturb those active growth plates, and we cannot put an implant across the growth plate that would interfere with it and cause premature closure. So we're going to use a cross pin technique, and now we've reduced the lateral fracture and placing an IM pin to hold it in place. Once this is done, we reposition Ivy and now make a medial approach. So we're going to reduce the fracture on the medial side and put a cross pin in there to affix that fracture in place once it's reduced. We cannot put a bone plate or bone screws across an open growth plate. These smooth IM pins will allow for the growth plate to continue to function as it was intended. That's the plan. And we still have a normal range of motion here. And so now we're closing it, and here's the post-operative x-rays of the repair, which look really nice. Here she is, the second day after surgery, still with the coaptation splint and the Robert Jones bandage. Now we've removed the bandage, and you can see she's placing that paw with every step and weight bearing already, doing extremely well. If we had any insult to the radial nerve, she would not be able to place that paw. She would just drag it. So she does have some proprioceptive deficit because of post-surgical swelling, but she can place it, and that's the important thing. Wonderful to see. She's doing very, very well. And here she is receiving a therapeutic laser, class 4 therapeutic laser treatment, wearing her goggles, and she's wagging her tail once again. So this is going to speed healing. It's going to reduce inflammation and decrease pain. Now we're 4 days post-op, and you can see she is hopping around using that leg extremely well. We're so pleased to see it. It is, of course, still fractured and being held together by the cross pins, but she's doing amazingly well. Now it's 2 weeks post-surgery, a beautiful day in May, and the grass is green, the sun is shining, and she's placing that paw with every step. She's limping, but this is only 2 weeks post-surgery from a very severe and devastating elbow fracture, and she's doing extremely well. It's very important to regain activity and use of that elbow early. If you put it in a cast, then she'd never use it again. So this is 6 weeks post-surgery, and now she is running like a sled dog, pulling her weight, very athletic, sleek, beautiful. Fun to watch. Even now, if it weren't for the scar, you wouldn't know there had ever been a problem. So this is a very good outcome from a potentially devastating injury. And now Ivy's come back to see us 3.5 years later. So look at that, running and jumping, jibing like a football player going down the field, like a running back. She is very agile, very athletic, very sleek, very gazelle-like. doing amazingly well, has been all of this time. And this is the very next day. So incredible, this recovery. We're so gratified and pleased to see Ivy doing so incredibly well. She's been a good patient, had a great life. We're very, very happy. And this is what we're here for. Columbus Small Animal Hospital, loving our work.